Good afternoon. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. It is April 15, 2025. We are performing an endoscopic surgery on this patient's spine, his lower back. Now, he's had back surgery before. He's had laminectomy. He's had the procedure that I tell everybody don't have it because it doesn't work. He's had laminectomy and he's having horrible back pain. His surgeon told him, have a fusion. That's what they do. They start by giving you a laminectomy, taking the bones and ligaments out of your spine, weakening your spine, making it hurt more, and then you come back with more back pain and you beg for a fusion. And that's what he was doing. He was about to have a fusion done, and he discovered Duke Spine on the internet. Here he is today, having the Duke laser disc repair. Now, if you look at his MRI, he's got 3 bulging discs, but his pain is really primarily just at the bottom. We're going to focus on just the bottom disc, the L5-S1. All right, I'm going to give him an injection, a little more numbing medicine, and if you have questions, feel free to ask. In the meantime, we're going to show you a video on all the causes of lower back pain. What are they? The most common is the disc problem, discogenic back pain. Second most common is the facet joints, third, the piriformis, and fourth, the SI joint. So those are the 4 most common causes. They account for 99% of back pain. Fractures account for about 0.5%, and then tumors and infections, the last 0.5%. All right, Henry, let's show the audience the most common causes of back pain. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. AP. Okay. Thank you for watching our animation, but it shows you that there are 30 different things that cause back pain. We have to identify in each patient which of those 30 they have. And the truth is that most patients have, on average, four things that are causing their back pain. I'm going to reposition my needle. No. Well, do you have one? We're good. I'm going to reposition my needle. I was really right there where I wanted to be, but I'm not happy, Sean, with the medial to lateral positioning. Sean? So I'm going to try again. I'm going to start a little more lateral, which is to the side, Sean. That's going to allow me to aim a little bit more medially in the foramen. I want to get more medial in the foramen. Medial means towards midline. And that's going to help me do a better surgery. Sean? So I have to reposition. Are there any questions? Sean?
Yes, there is a question coming from Lanu on YouTube.
Sure. Sean?
Asking question for Henry. The visuals is always excellent.
Sean?
It's so good that the viewers can see every tiny detail. How do you achieve such a high quality standard? In short, practice. It took time for me to really get the flow of everything and just making sure everything is going well and just making sure there's not a dull moment. So it's just with time, patience, you can accomplish anything really. But given that it's more of just staying consistent, just seeing what's right, what's wrong, and just going from there. That's all.
That's a good answer, Sean. All right, let's get an AP. Let's see where we are. So I tried a different trajectory. I wasn't happy with my starting point and my ending point. I wasn't happy with my ending point, therefore I had to readjust my starting point. Come to me. All right, good. I'm happier with that, but it's still a little bit too medial this time. I got to be a little bit more towards the side. Sean? Now he's had surgery already, and we want to avoid getting into the scar tissue, Sean, that the other surgeon created from his surgery. So I'm trying to navigate around that as well as to get around the facet. Sean? That feels a lot better to me right there. Sean? All right, let's see if we can make this work. Sean? That's better. All right.
Loss of resistance.
Any chance that he's...
How you doing, my friend? You okay? Don't move.
Hey,
Don't move.
lay still.
I'm gonna ask you one question
All right,
here.
just
Don't move.
let me write some stuff down.
move.
So you've watched. Thanks. You've watched the video. You know that the average patient with chronic back pain has four. So average is four causes. That could be 2 discs, 2 facets, or it could be 3 discs, 1 facet, 3 discs, an SI joint, 2 discs, piriformis. It doesn't matter. Any combination, 4 things on average. My staff reminded me we fixed the other 2 discs, 3, 4, 4, 5 already. Now we're fixing 5-1. So he didn't want to get 5-1 done originally. We're fixing it now. All right, so 5-1, the problem is there's a tear in the wall called the annular tear. Annular tear. And pieces of the nucleus are escaping and really stuck in that tear. And that causes inflammation and horrible back pain from the inflammation because there are little nerves that get irritated. All right, you ready?
How you doing, my friend? You okay? He's good, he says.
You having any pain?
Are you having any pain right now? No pain, he said.
Good. How about now?
Give us a number. Okay, what's the number on the pressure?
How bad is it? What's the highest it goes?
6.
All right. Is that where you get your pain?
What's that? Roughly, he said.
Okay, good. All right. When you wake up, we'll be done with surgery. Get to go to sleep now. Count from 1 to 100. 6/10, concordant. All right. So, just count out loud from 1 to 100. We've already apparently fixed the other 2 discs. He's not having pain up there anymore. He's having pain lower, he said, and that's the L5-S1. We actually recommended fixing it when he originally came in, and he wanted to hold off, just do the other 2 because they were worse. And now he's back to get the 5-1 fixed. So that's the story. He's going to sleep right now, and we're going to make our incision. Henry, let's show the audience, how do we fix people with pain coming from a disc, an injured disc?
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. We are basically advancing the dilator, which is going to spread open the fibers of the tissue. Everything okay?
Yep.
And once the dilator is into the herniation, then we're going to bring the tube down over the dilator. Sean? All right, so take that. Hold on. Let me just see. Sean? All right, go ahead. All right, we're inside the tear, inside the herniation, inside the disc. We're bringing down the tube that we're going to do the whole surgery through, called the endoscopic channel, or tubular retractor is another name. I'm advancing it into the L5-S1 disc, the tube, and I'm making sure we're not pushing the dilator in further. All right, I know we have a question, and then we're going to talk about facet joint pain.
Yes, we have a few
Thanks,
questions.
Monica.
This one coming from Lanu once more on YouTube, asking, He had previous operations. Did this patient have fusion?
Yeah, Lanu. So this patient did not know about us when he had his original surgery. He had a spine surgeon recommend a laminectomy for back pain and leg symptoms. And he did the laminectomy, but it didn't work. I think he did a second one. And eventually he was being recommended by that same surgeon to get what's called a fusion, spinal fusion. And he just thought, there's got to be a better way. So he started searching on the internet, found Duke Spine Institute, and decided he wanted to have see if he's a candidate for the Duke laser disc repair, the surgery we're doing now, and he was. So we saw him and recommended surgery, and that's why he's having this surgery. But yes, he was recommended for a fusion. He didn't want a fusion. He wanted something less invasive, safer, and better. So he was a fusion patient who chose not to do a fusion. But unfortunately, they got to his lamina before we could save him from a laminectomy.
This next question is coming from Barris on YouTube.
Hi, Barris. Welcome.
Saying, I've had a minimally invasive discectomy at the L5-S1 level. After 8 years, it still hurts every day, and I just found out about laser spine surgery. Do you know of any laser spine surgery being done in the Netherlands?
Hi, welcome to our channel. No, we have people from the Netherlands come here to Florida to our center, and we do their surgery here. You are welcome to come here and get your surgery done. If you're interested, please fill out our free MRI review form, and we do a consultation with you for free. There's no charge. All you have to do is provide us your MRI scan images, which are DICOM images. They're probably available to you either on a zip drive or CD, and you can sweep them into our portal on our website and get a free review. The problem is our curative treatments are being done here in Florida at Duke Spine and only Duke Spine. The Netherlands does not have this technology yet. As a matter of fact, nowhere in Europe is this technology available. Europe is still baffled by back pain. Baffled by back pain. It's not just Europe, by the way, it's most of the world. So only a few doctors in the world are able to diagnose the source. I've got 10 minutes left. Great question, and I hope you take my offer up and get a free MRI review. It's done virtually through Zoom. You don't even have to come here. We do it from the comfort of your home in the Netherlands. By the way, it was a group of Netherlands spine surgeons that recently published the first paper showing that fusion of the sacroiliac joint for SI joint pain does not work. We never recommend SI joint fusions. We know that procedure doesn't work, but many doctors still recommend it to their patients because it is a very profitable surgery for the surgeon. They make a lot of money doing it, more than most any other type of surgery. And patients are suffering worldwide because of unnecessary fusions of the SI joint that doesn't work. All right, so what we're finding here, the blue stuff is the herniation, and it's quite a big tear. There's a lot of scar tissue here. So this tear has been here a long time, and his body has tried to heal it through the process of inflammation. All of us in life have injuries to our bodies. All of us. Skin gets cut, bones get broken, muscles get torn, and so on. And the way our bodies heal, the first step of healing, is that you moving him? I'm almost done. The first step of, that's fine. The first step of healing is when our bodies do something called inflammation. Inflammation. Inflammation is the first phase of healing. Your body starts the inflammation in the area where the injury is. I need 2 minutes. In his case, what's injured is his disc. And you're doing great. A lot of bone. Look at all this scar tissue. This has been, his body's been trying to heal this for a very long time.
We have another question
I'll take it.
coming from Wayo on YouTube.
Yeah, this is going to be the most sensitive part right here. So we got another minute and we should be done. Go ahead, Wayo.
Wayo asked, what's the benefit of doing this surgery versus the other methods?
Well, the first benefit of the Duke laser disc repair is that this works. It actually cures back pain that comes from a disc injury. The other surgeries don't work. The only other surgery that works is a fusion. Fusion of the painful disc will work as long as the fusion is done properly. The other benefits over fusion, for example, is that the recovery is 1 hour. 1 hour you can go out to a restaurant. You cannot drive a car today, but you can go back to work in a day. So it's a very fast recovery. A third benefit is our patients do not take narcotic painkillers or opioids after the surgery. They don't need to. You see, with traditional surgery, they have to take opioid painkillers because the pain from the surgery is so severe, and that pain takes weeks or months to go away. The reason why is, I'm almost done. The reason why is those other surgeries, the open surgeries, cause damage to the body. While the surgeon's in there, the surgeon is cutting with a scalpel. They're cutting ligaments, they're cutting muscles, they're destroying ligaments, destroying muscles, destroying bones, and all that damage to your body with fusion surgery and laminectomy surgery. It takes a long time to get over the pain from that internal damage, okay? Our surgery does not cause any internal damage, therefore the patients don't need pain meds because there is no pain afterwards. There's very minimal pain. Another difference is complications. We've never had a complication with this surgery in 20 years. No blood clots, no pneumonia, no heart attack, no infection, no nerve damage, no spinal fluid leak, no adjacent segment disease, no anything. Basically just great results without complications. You can't say that with fusion. Fusion complication rate is as high as 50%. 30 seconds. Yeah, fusion complication rate is as high as 30%. 50%. And it depends on who does your surgery. Most surgeons, their complication rate is around 25% for spinal fusion on average. So, why would you want to do a surgery that's going to give you a complication? I wouldn't.
Follow-up question from Wayo once more on YouTube saying, I have 2 herniated discs at L4-5 and L5-S1. Can I lift weights, swim, and do my normal activities? I'm taking pain meds daily, and I've been on and off on them for 7 years.
Yes, Waylon. When we're done with your back, we're going to fix it. You won't need to take pain meds, and you can go back to 100% normal life. You need to give yourself a few weeks to recover, and then you can go back to doing everything you want to do without that pain. All right, we're done, and we're going to wrap this surgery up. It was a quickie. It was a 1 disc, and it went very well. We had no complications. We lost about 5 drops of blood, maybe 10 drops maximum. That's let's just say 1 cc of blood. That's it, bleeding. And he's going to go home in an hour. His wife is here to take him home. All right, any other questions?
No current questions.
Why don't we end with a testimonial?
Yes.
One of our patients. By the way, our patients do testimonials for free. We don't pay them. They actually pay Duke Spine for their surgery, and they offer to do testimonials for us. So they're real patients with real stories. Thanks, Henry.
Of course.
I'm Dr. Duke Machen, CEO and founder of the Duke Spine Institute. I have a patient with me who just had the Duke laser disc repair less than 24 hours ago, about 12 hours ago. And here you are. How do you feel today?
I feel better than I have in probably half a year. I'd say close to 5 or 6 months. It's one day after, and time will tell, but I didn't think this was possible this quickly.
Yeah, time will tell. We've done now 2,200 of these surgeries with the laser endoscopic. Consistently, the pain is gone. It's permanently gone. It never comes back. And so I'm excited for you that you're gonna do fantastic. Now, you live about an hour away. How did you find out about Duke Spine Institute?
I got a referral and noticed that it was only an hour away, so made my way up here, and the first time I came for a visit was kind of felt like home, kind of felt like where I should be anyway, so that kind of fit right into everything this far. So
You had, was it back and leg pain, correct?
back pain a little bit, but my biggest issue was shooting down the leg pain. It was numb all the time for about 4 or 5 months on and off, so didn't know what else to do, and this was the right choice, I would say.
You came to us and we found weakness also. You had weak pulling your toe up. That's because the nerve was pinched so bad at L5-S1. You can see here on the video, we went in with a tiny Band-Aid incision, 1/4 inch. We went in and basically removed most of the herniation, cleaned up the tear where it came out of so that the tear will now heal. Your disc will heal naturally. And we did it all without removing bones or ligaments. If you had had a microdiscectomy or laminectomy, which is what every other surgeon offers, because they don't know how to do the endoscopic surgery, it's a newer technology, then you would have had a bigger incision, you'd be in a lot more pain today, and you'd have bone and ligaments taken out of your back. It would weaken your spine, which would set you up for fusion. But with our surgery, there is no need for any future treatment on the disc. It's permanently fixed. Now, are you taking any pain meds today?
I haven't yet today, and I haven't felt the need to, which was another surprise I had too.
Yeah,
So
no pain meds, right?
Nothing.
No bleeding, no hospital, no pain meds.
Nope, in and out pretty quick. It worked out pretty well.
Pretty happy?
I am.
And you were referred through Coral, right?
Correct,
Coral
correct.
Network.
Coral Network.
What do you have to say to the Coral people who approved your surgery?
I just appreciate the approval and the opportunity to live like normal and be a normal human again.
Yeah, Coral did you well. I guess they somehow got you to us and you avoided having an invasive surgery that was going to hurt you more than help you.
Correct.
Congratulations.
Yeah, well, thank you, Doc.
Anything else you want to say to your fans out there in YouTube land?
I would just encourage you to look into Duke Spinal and figure it out if that's the right fit for you, and it was for me, absolutely. So, thank you.
You're welcome, my friend.
Appreciate it.
Congratulations.
Take
Take care.
You too.